Alrighty.
Hi, this is Dr. Foote, and I wanted to show you how we can safely get a dog like this out of, a vehicle. So I've got some treats in my hand, and if we can feed the dog, I can give her a couple, just one or two. Good job. And now I want her to lure her head through this the double loop lead. Very good. So I avoid the reaching over. Okay, I'll show that again because I know that was quick. So see, we have our one lead. Remember, like so, the top D. I know these are required by AHA and they are best, so we don't have a dog slip out of their collar, or they have the flexi that doesn't lock and drops out of your hand. So we want to make the D kind of big, the D ring on top, and the controlling part here. Hold them together like so, excuse me. So we can lure with our hand, or we can use a target item. Like this is and Bella likes peanut butter. Very good. So I'm going to entice her by doing like so. And so as she's sitting there, now I can draw my leads tighter before we get her out of the vehicle. Now this is her own leash, so I will hold that too so we don't trip over it. And I'm going to say, okay, Bella, come on down. And so the dog chooses, sorry, baby, to come on down. Okay? And then now when we walk with her, it's really important to keep the leash short, not necessarily tight, but we do not want the dog pulling and weaving all over. All that pulling and weaving agitates the dog more and gets them more kind of worked up as we're taking them into the practice. So I say, okay, bye, Mr. Wold. I'll bring Bella back in a minute. And as I close the door, I might give her another, hey, you, little reward, which now she's not quite interested in because she knows she's going somewhere different. But the leash handling skills are important to have. Double up the leash. You also can hold it through, the loops you can hold through your fingers or hand like so. I don't usually like it around the wrist like this because if the dog jerks, they may injure your wrist or it may fly off your hand. So usually, sweetheart, held like so. It's okay. And we're going to come here. And, hey, Bella, you want that? Good girl. And when you reward the dog, have it go there. Now, I don't want good girl. So we're going to slide the hand. I know this gets klutzy, but this is how life is, right? Slide the hand, hold on to the two loops. And then when I say, okay, Bella, let's go. We're going to walk. Good job, good job. And use a lot of verbal praise and walk with purpose wherever you need to go. Because your direction is what's teaching the dog. Now, she wanted to bolt forward, so I step back. Don't pull on the lead. If a dog wants to really bolt in front of something, you can body block like so, and then say, good girl, and then continue to lead on. Good job, let's go. And when you make your turns, make sure you have your feet close together as you turn. Good girl, Bella, let's go. And then you can take them where they need to go. Very good, very good. Okay, so this is how we can lead the dog. Now, there's traffic going by, and there's a lot she wants to sniff here. You may allow a little bit of sniffing. Sniffing can help calm a dog, help them get oriented to where they are. But these are some ways to help move them into the clinic and minimize agitation or the sight of other animals. Say if traffic going by agitates her, come here, Bella. We can have her go behind the car here and wait a second as that traffic goes by and then continue on. If this dog was getting very, totally sat down, would not move forward away from the owner's vehicle, then I would do my examination outdoors. And where would I do this? I would look for maybe just a grassy area over here. I know it looks kind of dumpy back here, but a lot of our dumpster areas do, don't they? Or we might even go back here, in there, behind the dumpster with this dog, and come here, Bella. She may even be able to see perhaps her vehicle, and she will be less agitated here. We can do the exam, we might be able to do the blood or do the rabies vaccination, whatever is needed, and then when we're done, good job, we're going to take her back to her own vehicle. Now for getting her back in the vehicle safely, this is a high truck, and she's an 11-year-old dog. So she may not be able to make the jump in there, and we don't want her to get injured doing so. So to be safe, there's a couple things we want to do. We're going to need to coordinate a couple things, right? We need to get the double leash off of her. and then we're going to lift her without her possibly being able to flip and to bite at us. So what we'll need to do is have a blanket or a hood, and this has been sprayed with the Daptol. So we can, what I would do is open the door. Hi, Mr. World, we're getting Bella right in. And if the client can help you, that's great, but we're supposed to minimize our client contact. If we cover over the dog's head, come here, Bella. And if we need to lift, the proper way to lift then is have your arm underneath and around the head like so, and then on the count of 3, 1, 2, 3, lift, and this way the dog cannot flip and bite you. Now we'll put her into the vehicle, and there we go. Still keeping her head covered. Now, still keeping her head covered, we can either undo the leashes, or I may even just say to the client, keep the leashes. And then body block her back as you close the door so she does not escape out. If she, let's take her outside, and let's say she wants to jump in the vehicle. No. That's a good girl. I would, hey, let's do this. Let's hood you over for a second. This hooding make you a little more upset. Like that. Get her out. Yeah. And then, hang on. Let me just take these off right now. So let's say we're going to put her back in the vehicle. Come here, Belle. We could take a handful of food, like so. Bella. And we could throw it up in here. There she goes.